My name is Sheridan Rowling, and for my policy topic, I'm going to be discussing national health insurance. National health insurance, otherwise known as NHI, offers affordable health care to everyone regardless of income or employment status. As you have probably seen and heard, national health insurance is a hotly debated topic within our nation's politics. There are two viewpoints for national health insurance. One is offering national health insurance so individuals can get health care at a low and affordable rate to help encourage their well being and the well being of their family. Or there is the option of tax subsidies. Tax subsidies would offer money to these individuals without insurance to pay their premiums to private insurance companies as a means to gain health insurance. However, there can be some challenges to tax subsidies as we do not know who is in need of how much money for their premiums, and not always do these private insurance companies offer the best options on their lower level. Approximately 44 million Americans are uninsured. I have seen this number kind of fluctuate during my research and have chosen 44 million as my middle ground. This number is constantly changing, and in the recent years it has been rising. National health insurance demonstrates that it will give individuals the opportunity to live their best life and be able to go to the doctor when needed without fear of compiling a bunch of debt and bills because they're unable to afford emergency room visits, and also the hospitals aren't incurring all of that extra debt that for bills that go unpaid every year. An analysis I found demonstrated that if low-income individuals transitioned to Medicare from their private insurance companies, they would save an approximate around $1,600 annually, and that includes premiums as well as out-of-pocket expenses, so maybe co-pays, prescriptions that may not be covered, or medical devices. Additionally, to pull from Taiwan, who has in the last couple of decades implemented NHI, when they first did this, there was an increase on financial strain for the cost of making a national-wide health insurance program. However, that was only within the first year. Research showed from this study that total spending per person for Taiwan was $686, and total spending per person for the United States was $4,373 per person for that year, and this is in US dollars. Lastly, the national health spending percent as a gross domestic product for Taiwan was 6%, and the United States spent about 13% of their gross domestic profit on health spending. And this is with Taiwan implementing the national health insurance. However, there are many individuals who believe that national health insurance should not be an option, and we should stick to the free market and allow private companies to stay afloat. Research has shown for those who believe in not implementing national health insurance that there is a high mortality rate for individuals who are uninsured, initially thinking that this is due to a lack of care because they are unable to pay for the appropriate care. However, this may not change with insurance if the United States were to implement national health insurance. Additionally, within the study, there um, they noted that individuals with Medicaid and Medicare, which is a nationally funded health insurance, public insurance, those individuals had a higher mortality rate than those without, therefore demonstrating that the insurance is not impacting the mortality rate of individuals. Secondly, because it is a nationally funded program, there would be an increase of taxes, and that is still unknown, and it is unknown how each state would manage their national health insurance or if it would be regulated nationwide. Oregon did a study with what they call the health insurance lottery through Medicaid. This lottery gave individuals health insurance similar to Medicaid if they did not meet the requirements for Medicaid within the state of Oregon. Individuals who received the lottery winnings through the Oregon Medicaid system were followed within a postal code area that contained 12 hospitals. The researchers were interested to see that individuals who had received Medicaid, as opposed to those who were previously insured or had no insurance, utilized the emergency department 7% more than the other individuals. This demonstrates to me that if national health insurance were to be implemented, it is more likely that there will be a higher rate of emergency room visits, and thus raising the possibility of raising taxes for everyone within the United States. These are several reasons why national health insurance can be a very big strain within the United States, and it doesn't demonstrate the longevity of individuals' lives. As I previously mentioned, individuals who were previously on Medicaid and Medicare had a higher mortality rate than those without. Thank you.